It's late. The house has gone quiet. Your partner is asleep, the dishes are dry on the rack, the refrigerator finishes its hum and clicks off. And in that moment, when the world is supposed to be silent, your ears aren't. There it is, the high, thin ring above your right ear, the soft electric hiss behind both of them. The cricket sound nobody else hears. The thing that wasn't there 20 years ago that you first noticed in your late 50s or early 60s that slowly became part of your nights. You've stopped mentioning it. You went to the doctor once, maybe twice. They looked in your ears. They told you it was age. They told you the hair cells in your inner ear were tired. They sent you home. And over time, you learned to live with the sound. I want you to stop and listen to me carefully for a minute, because that sound, the one nobody else can hear, is not coming from your ears the way you've been told. Or at least, not only from your ears. It's a signal. And the signal is being made somewhere deeper in your body than anyone has explained to you. For a lot of people watching this video who are over 60, the place where that sound begins is not the ear. It's the blood. One vitamin sliding lower in your bloodstream year after year. One nerve running from your inner ear into your brain, quietly losing the protective coating that keeps it from firing on its own. Tonight, I'm going to walk you through that chain, step by step, backwards from the sound in your ears all the way down to the part of your stomach that stopped doing its job around the time you turned 60. One quick note before we go further. The pattern you're about to hear, where the body sends a loud signal from one place while the real problem sits somewhere else, isn't unique to tinnitus. It runs through swollen ankles, foggy mornings, heavy legs, the whole drainage system after 60. I put the broader framework into a short, evidence-based book called The Drainage Protocol, written in plain language for adults over 55. The link is in the description. If tonight's video makes sense to you, the book takes the same way of thinking and applies it across the whole body. You don't need the book to follow what I'm about to explain, though. So back to your ears. If you've been hearing that ring or hiss or buzz for more than 6 months, and especially if you're over 60, here's what you've probably been told. It's age. It's loud music from when you were younger. It's noise damage. It's the small hair cells in your inner ear giving up. The advice usually comes in 3 forms. Get hearing aids, try a sound machine to mask it at night, learn to live with it. That's the standard answer. It isn't wrong, it's just incomplete. Tinnitus, and let me translate that. Tinnitus is the medical word for hearing a sound that isn't coming from any object outside your body, is a symptom, not a disease. A symptom is a signal, and a signal is only as useful as the place you trace it back to. If you trace tinnitus only as far as your ear, you stop one step too early. The ear is where the sound is announced. The cause is upstream. So let's walk the chain. We're going to start at your ear and go backwards, one step at a time, until we hit the part of your body where, for a great many older adults, this whole thing actually begins. The first step is your inner ear and the nerve that leaves it. Inside your inner ear, there's a small spiral structure called the cochlea, about the size of a pea. Inside that spiral are tiny, hair-shaped cells that vibrate when sound waves hit them. When they vibrate, they send a signal up a single nerve, the cochlear nerve, sometimes called the auditory nerve, into your brain. The brain receives that signal, and you experience the sound. Here's the part nobody at a 15-minute appointment has time to explain. The cochlear nerve is not a single wire. It's a bundle of about 30,000 individual fibers, each one carrying a piece of the signal. Every one of those fibers is wrapped in a protective layer called the myelin sheath. The myelin sheath is the white, fatty coating around a nerve fiber. It's the insulation. Picture for a moment an old telegraph wire. The wire runs from one station to another across a long stretch of country. Around the wire, there's a layer of rubber insulation. The insulation does 2 things. It keeps the signal traveling cleanly from end to end, and it keeps the wire from picking up stray static from the wind, from passing storms, from other wires nearby. When the insulation is whole, the signal at the receiver is clean. When the insulation starts to crack, when small bare spots appear along the wire, 2 things happen at once. The signal slows down, and the wire starts to pick up static from everywhere along its length. That's exactly what's happening at the nerve fiber level for many older adults, with persistent ringing or hissing in the ears. The hair cells in the cochlea may be fine. The brain may be fine. The wire, the cochlear nerve, is the part with cracked insulation. A nerve with cracked insulation does not stay quiet when it's supposed to be quiet. It fires on its own. The brain receives that random firing as sound, as ringing, as a hiss, as a cricket. That's what tinnitus often is, mechanically. There's no extra sound being made outside your body. It's your own auditory nerve, fibers misfiring through gaps in the myelin sheath, sending a signal into a brain that has no way to tell the difference between a real sound and a leak. So if that's the first step, the obvious next question is, why is the insulation cracking? That's the second step. Step 2 is the myelin sheath itself. What is it made of? How does the body build it? And what happens when it stops being built properly? Myelin is made mostly of fats and proteins. The fats are called sphingolipids, a small detail you don't need to remember. What you do need to remember is this. The body cannot make those fats correctly without two specific raw ingredients. One is folate, a B vitamin. The other is vitamin B12, also called cobalamin. Of those two, B12 is the one that becomes a problem far more often after 60, for reasons we'll get to in a moment. When B12 in your bloodstream drops below a certain threshold, and we'll talk about what that threshold is, the body can't keep up with myelin maintenance. Nerves throughout the body slowly start to develop those small, bare patches I described in the telegraph wire analogy. This happens silently. It doesn't announce itself. There's no pain. There's no obvious moment of damage. But over months and years, the insulation thins. The auditory nerve, because it's so densely fibered and so finely tuned, is one of the early places where this shows up. Long before you might notice numbness in your toes or a strange feeling in your fingers, which are two of the other classic places where low B12 nerve damage appears, the auditory nerve may already have started to lose its cleanest signal. The first thing you hear is no longer silence, it's a ring. There's real research behind this connection. A study published in 1993 Inches, the American Journal of Otolaryngology, by a group of researchers including Shemesh and Atias, looked at adults with chronic tinnitus and tested their B12 levels. 47% of the patients with chronic tinnitus were found to have a vitamin B12 deficiency. 47%. Roughly 1 out of every 2 people in their study, walking around with persistent ringing in the ears, had low B12, and most of them did not know it. A more recent paper in the journal Noise and Health, published in 2016, confirmed the connection in a separate population of older adults. So we have a mechanism. Myelin around the auditory nerve depends on B12. When B12 drops, myelin maintenance drops with it. The nerve develops microscopic gaps. The nerve fires when it shouldn't. The brain hears that misfire as sound. That's step 2. The myelin sheath is where the body's deficiency starts to make itself audible. You and I both know your last appointment didn't sound like this. If you want more of this kind of walkthrough, subscribe. That's the whole engine that keeps these videos coming. Now we move another step down the chain. If myelin is the insulation, and B12 is what builds and maintains the insulation, then the next question is the one most people never ask. What exactly is B12? And why does it disappear from older bodies so reliably? Vitamin B12 is a water-soluble vitamin made almost entirely by bacteria. Plants don't make B12. Animals don't really make B12 themselves either. They get it from the bacteria in their guts and in their food. By the time it reaches your plate, B12 is found mostly in animal foods. Meat, fish, eggs, dairy, and shellfish are the main dietary sources. Some plant foods are fortified, like certain breakfast cereals and certain nutritional yeasts, but for most adults over 60 in the United States, the dietary B12 in their meals comes from animal foods. Here's what B12 actually does in your body once it gets there. It does 3 big jobs. The first job is the formation of red blood cells. Without B12, your bone marrow cannot make red blood cells the right size, and you become anemic with very large, oddly shaped red cells, a condition called megaloblastic anemia. The second job is DNA synthesis in every cell that divides. The third job, and this is the one that matters most for tonight's video, is the maintenance of myelin around your nerves. All 3 jobs matter. But the third one is the job that, when it fails quietly, you hear as a ring in your ears. The threshold for B12 deficiency on a blood test is a number worth knowing. In the United States, most labs flag a serum B12 level below 200 picograms per milliliter as deficient. But here's the catch, and you should remember this. Many older adults begin to develop nerve symptoms, including tinnitus, at levels between 200 and 400 picograms per milliliter. That's the gray zone. The lab calls it normal. The nerves do not. This is one of the most important things I want you to take away from tonight. If you ask for a B12 blood test and the result comes back at, say, 240, your clinician may tell you you're fine. Mechanically, your nerves may not agree. There's an additional test called a methylmalonic acid test, which catches functional B12 deficiency at the cellular level, even when the serum number looks acceptable. If you have persistent tinnitus and your serum B12 is anywhere under 400, that second test is the conversation to have at your next appointment. So now we know. B12 is the raw material. The shortage of it is the problem. The next question, and this is the fourth step, the one almost no one ever explains to people over 60, is why does B12 disappear from older bodies in the first place? That's where this gets specific. Step 4 is your stomach. Two things in your stomach that change with age. When you eat a piece of meat or an egg, the B12 in that food is bound to a protein. Your body cannot use it in that bound form. It has to be unwrapped. The unwrapping happens in your stomach, and it requires two things to happen at once. First, your stomach has to make enough acid, what's called gastric acid, the same acid you might think of as causing heartburn when there's too much of it. Second, your stomach has to make a small protein called intrinsic factor. Intrinsic factor is made by cells in the stomach lining called parietal cells. Its only job is to grab the free B12 after the acid releases it and carry it all the way down to a specific part of your small intestine called the ileum, where it's absorbed into your bloodstream. Think of it as a relay race with two batons. The first baton is stomach acid, which unwraps the B12 from the food protein. The second baton is intrinsic factor, the carrier that delivers the unwrapped B12 to the absorption door at the end of your small intestine. If either baton is dropped, the runner doesn't finish. The B12 passes through your digestive tract and leaves your body unused, no matter how much you ate. Here's what happens to that relay race after 60. A condition called atrophic gastritis becomes more common with age. Atrophic gastritis, and let me translate that. Atrophic gastritis means the lining of the stomach has thinned and lost some of its working cells. It affects an estimated 20 to 30% of adults over 60 in the United States. That number rises with each decade. By 70, it's closer to 1 in 3. When atrophic gastritis develops, two things drop at the same time. Stomach acid production falls. Intrinsic factor production falls. Both batons in the relay race get smaller. So even an older adult eating a B12, rich diet, meat at lunch, eggs at breakfast, fish on the weekend, can be slowly running short. The food carries the vitamin in just fine. The stomach can't unwrap it. The carrier can't carry it. The vitamin walks out of the body unabsorbed. The blood level drops, slowly, year by year. The myelin around the auditory nerve thins. The fibers begin to misfire. And one quiet night in your 60s, you start to hear a ring that wasn't there before. There's one more piece to this part of the chain that I don't want you to miss. Several common medications that older adults take every day make this absorption problem significantly worse. Acid-suppressing medications, the ones often called proton pump inhibitors, with names ending in the syllable prazole, directly lower stomach acid. They're commonly prescribed for heartburn, for reflux, and for ulcer prevention. A second class, called H2 blockers, does something similar. And metformin, a very widely used medication for type 2 diabetes, also reduces B12 absorption through a different mechanism in the small intestine. A 2010 randomized trial published in the British Medical Journal found that long-term metformin use was associated with measurably lower B12 levels in older adults. If you take any of those medications and you have tinnitus, the conversation with your clinician is not about stopping them. Never stop a prescribed medication on your own. The conversation is about whether your B12 should be checked and whether supplementation should run alongside the medication. That's a normal, safe, evidence-supported conversation to have. So now we've walked the whole chain backwards. Let me pull it together in one paragraph because I want you to be able to repeat this to your spouse, your sister, your doctor. For many adults over 60 with persistent ringing in the ears, the chain runs like this. The stomach has thinned with age. Stomach acid and intrinsic factor are both running low. The B12 in the food isn't being absorbed. The level in the blood drops below the threshold where myelin maintenance keeps up. The myelin around the cochlear nerve thins. The fibers begin to misfire. The brain receives those misfires as sound. You hear it as a ring. The sound is real. The cause is not in your ear. It's in your blood, and it began in your stomach. I have to slow down here and say something carefully. Tinnitus has many possible causes. Not all of them are vitamin-related, and some of them are serious. Before you do anything else, listen to the next list. If your tinnitus is only in one ear and not both, that's a finding that needs medical evaluation, not vitamins. One-sided tinnitus can sometimes be a sign of a small, benign growth on the auditory nerve called an acoustic neuroma, and it should be checked. If your tinnitus pulses with your heartbeat, what's called pulsatile tinnitus, that's a separate category and needs vascular evaluation. Don't assume it's B12. If your tinnitus came on suddenly, over hours or days rather than over months or years, see a clinician soon. Sudden hearing changes can sometimes be reversed if they're caught within the first 2 weeks. If you have new dizziness, balance problems, or hearing loss, along with the tinnitus, that combination needs an ear, nose, and throat doctor. It is not a do-it-yourself situation. And finally, the most important caveat in tonight's video. None of what I'm about to tell you about diet, testing, or supplementation replaces a conversation with your own clinician. The point of this video is to give you the framework to have a smarter version of that conversation, not to skip it. With all that said, here's what to do tonight, this week, and this month, if you suspect low B12 might be part of your tinnitus picture. Tonight, do one thing. Write down on a piece of paper or in the Notes app on your phone 3 answers. First, how long have you had the ringing? Second, is it both ears or one ear? Third, what medications are you currently taking? Especially anything for acid reflux, anything for type 2 diabetes, and anything taken daily that you didn't start in the last year. Bring that piece of paper to your next clinical appointment. That alone is going to make the conversation 40% more useful. This week, look at 3 things in your diet. First, are you eating any animal foods at all on a regular basis? Meat, fish, eggs, or dairy? If the honest answer is rarely, then dietary B12 is probably contributing. Second, are you eating fortified foods? Certain breakfast cereals are fortified with B12 and listed on the label. Third, if you're vegetarian or vegan and over 60, you're in a higher risk category, and supplementation is almost certainly worth a conversation with your clinician. This month, ask for 2 specific blood tests at your next appointment. The first is a serum vitamin B12 level. The second is a methylmalonic acid test, the one I mentioned earlier that catches functional deficiency even when the serum number looks normal. If your clinician asks why, you can say, I have persistent tinnitus. I'm over 60, and I want to rule out a functional B12 deficiency before assuming it's only age. That's a reasonable, supported request. If your B12 comes back low, under 200, supplementation is standard care, and your clinician will guide the form. For most older adults with low B12 and intact absorption, oral cyanocobalamin or methylcobalamin tablets at high doses are effective. For those with severe atrophic gastritis or pernicious anemia, injections may be required because the stomach simply can't do the unwrapping anymore. If your B12 comes back in the gray zone, between 200 and 400, that's the conversation where the methylmalonic acid test earns its place. If the methylmalonic acid is elevated, your body is functionally deficient, even though the serum number looks acceptable, and supplementation becomes reasonable. In the meantime, and this is the part you can start tomorrow morning, regardless of test results, take a look at where B12 sits in your week. 2 whole eggs at breakfast, several times a week, deliver about 1.5 micrograms of B12 each. A 3-ounce serving of beef or lamb delivers between 2 and 3 micrograms. A 3-ounce serving of salmon or tuna delivers between 2 and 5 micrograms. Plain yogurt delivers around 1 microgram per cup. The recommended daily intake for adults over 50 is 2 and 4/10 micrograms. But for older adults with absorption issues, the working amount may need to be much higher, which is exactly why supplementation under a clinician's guidance often becomes part of the answer. If low B12 is part of your tinnitus, here's the honest timeline of what reverses and what doesn't. In the first 2 to 4 weeks of repleting B12, most people notice no change in the sound. That's normal. The myelin sheath is being repaired, but it takes time. The body has to assemble new fatty layers around thousands of nerve fibers. There is no overnight on this. Between 4 and 12 weeks, some people start to notice the sound becoming quieter, or less constant, or easier to ignore. Not everyone. In the studies I mentioned earlier, when B12 was supplemented in people who were deficient, a portion of them, not all, saw measurable improvement in tinnitus loudness by the 3-month mark. Between 3 and 6 months, the picture is easier to read. The people whose tinnitus was driven mainly by B12, related demyelination, tend to see lasting reduction in the sound. The people whose tinnitus had other causes layered on top, noise damage from earlier in life, other nerve issues, blood pressure changes, see partial improvement at best. What doesn't reverse, even with perfect B12 replacement, is damage from other sources. Years of loud noise exposure cannot be undone. Those hair cells in the cochlea cannot be regrown. If you have nerve damage from other causes, B12 alone will not undo it. This is why the tinnitus picture in any individual person is almost always layered, and why the B12 piece is one important link rather than the only one. But it's a link that can be checked, and often fixed, with 2 blood tests and a conversation. That's not nothing. Before we close, do one thing for me in the comments below. Tell me how old you are. Are you in your 60s, your 70s, your 80s? The mechanisms I just walked through change a little with each decade. Atrophic gastritis is more common in the 70s than the 60s. Medication overlap shifts, dietary patterns shift. The more I know about who's watching, the more I can shape the next walkthrough. Drop your decade in the comments, and while you're there, tell me whether the ringing started in the last year or further back. That sound in your ears, the one nobody else can hear, is a signal. It isn't random, it isn't just age. It's your auditory nerve telling you in the only language it has that something upstream, possibly in your blood, possibly starting in your stomach, has slipped below the line. Now you know the chain. Now you know what to ask. The next conversation you have about it will sound different from the last one, because you'll know which links to check. I'll see you in the next video. Take care of yourself tonight.